Well, welcome to Let's Talk Lupus. Today, our topic of interest is social prescribing. What is it? How does it work? And current barriers. Joining me today is Dr. Kate Mulligan, who is an assistant professor in social and behavioral health sciences in the Dalla School of Public Health at the University of Toronto. Dr. Mulligan was instrumental in the formation of the Canadian Institute of Social Prescribing. Dr. Mulligan is globally recognized expert in community approaches in health and well-being, evaluation and research, and led one of Canada's first social prescribing pilot projects. Welcome, Dr. Mulligan.
Thanks so much, Leanne. I'm really happy to be here with you today.
Wonderful, thank you. Do you want to share with us a little bit about your background in social prescribing, and then we'll head into the questions?
Yeah, I'd really love to. And I think you said it very well. I've been involved in community health and neighborhood level health for a really long time. I'm a health geographer by training, so I'm very interested in people's relationships with themselves, with one another, with the environments they live in, their neighborhoods, but also things like with politics and culture and how that all intersects to produce our health and well-being. So yeah, I mean, what I try to do in my work and what I've been doing for the last number of years is really help us to take action on what we already know, that these social and environmental determinants of health impact more than 80% of our health outcomes. And less than 20% comes from what happens in clinical care. So we've known that for a long time, but we're still not really acting on it in a deep way in our health systems. And so that's a big part of what I'm trying to do with social prescribing. Well, social prescribing builds on millennia of human activities. So it's not a brand new idea. We've always known that taking care of one another matters a lot, that being around other people, our social health and well-being matters a lot. And we've got decades of research evidence now about those other big determinants of health, our housing, our income, our employment, our experiences of, discrimination and inequity. Those all add up to stressors in our lives and challenges for our health, or supports on our health if those things are going well for us in our lives. So social prescribing tries to mobilize what we know. And so here's how it works. You might go to your primary healthcare provider, your doctor, your nurse practitioner, with a challenge that's sort of outside their clinical training. Maybe you are lonely, or maybe you're experiencing food insecurity. And it's something that they can recognize, but not necessarily address, given the training they have, the time they have, and the networks they have. So with social prescribing, what they can do is make a referral to somebody who's called a link worker or a community connector, who can take the time to really talk with you and listen to you and get a more holistic picture of what's going on in your life. And so we often say that conversation helps you shift from what's the matter with me, which is the biomedical model, to what matters to me, which is the social prescribing and community development and health promotion model. And then together with that link worker, you can make a plan to really address what's important to you in your life. And it might be really different from what the clinician thinks you need to do next. Maybe before you're prepared to make diet changes, for example, you need to address something else that's going on in your life. Maybe you have you need therapy to help reconnect with your family members and caregivers, for example, or you want to be able to spend more time doing something that you love so that you can have the capacity to do these other clinical things that are important for your health. And so the link worker can help you and actually go with you. They accompany you sort of emotionally and sometimes physically. So if you need help making that first step, and we know you do when you're lonely and socially isolated, not feeling that great, you actually need a bit of a boost to get out there to that first gardening group or peer support group. And then ideally, we're tracking all that in the electronic medical record, so we can finally get a sense of, how does this work? Is it impacting your health? Is it changing how often you're going to the doctor? All of those kinds of things. And that's the basic model of social prescribing.
Amazing. Excuse me. Going back a bit, how did social prescribing get started? And to add on to that, I know we're talking about you tracking, and I believe you'd mentioned once before to me that it started in the UK and they've seen great success. And,
Yes.
what does that look like?
So the components of social prescribing have been done, like I said, all around the world. And so there are many people here in Canada who will say, hey, I already do that. I'm an occupational therapist, or I'm a social worker, or I'm a physician, and once in a while I make a referral to spend time outside or, be with a pet. But it's really happening ad hoc, and there's no systematized way of doing this. And so what they did in the UK was invest heavily in social prescribing. So first, making sure that every primary care network across the country in England had access to a link worker. So they invested in 2019 in 1,000 link workers. Now they're going for every primary care provider having access to a link worker, and they've got up to 3,500 link workers in the country. So it's shown dramatic success for the people who really need it, in making sure that they have this sort of peer accompaniment in their lives and can start to address some of the social needs that are emerging in their lives.
Are you finding now, I know we're sort of on the cusp of this in Canada, are you finding a lot of uptick with doctors here that are willing to prescribe this, or how do they fit that into their current sort of appointment time with a patient?
Yeah.
Is it helping?
We're seeing it grow really rapidly here in Canada. We started with a pilot project that I led in 2018 and 2019, which was in 11 community health centers in Ontario, where I live. And they were really different kinds of settings. So a northern setting, a remote setting, a francophone setting, an urban setting, one focused on older adults, right? So all different kinds of populations and people, and they made social prescribing happen in a way that made sense for them. So they looked at the resources they had available, the needs in the community, and the interests of the participants and their strengths. So it really does try to start with what's strong with us more than what's wrong with us. And so, we're seeing it in every province across Canada now. But it's happening in this decentralized way. And the leadership is often coming not from the healthcare system proper, but from community organizations. So sometimes disease-specific organizations with peer support, like Lupus Canada, and sometimes from local community organizations. So in BC, for example, United Way is funding, working with the Ministry of Health, and they've funded 100 community connector positions focused on older adults in the community, and then they build the linkages to the healthcare system from the community side. So that's really where we are now. It's happening a lot, and more governments are starting to take interest. So it's really exciting. And I think one of the reasons is it works so well and it feels so good. So the more involved you get with it, the more you want to do it.
Yeah. Amazing, truly amazing. And I think, like you said at the beginning, it's something that we all do, but we don't recognize it. And we sometimes need that push and that link to help us, because obviously there is a concern around mental health and mental well-being, and this can really assist folks, especially those living with lupus, being able to have those conversations with someone and given some recommendations as to things they can do, like you mentioned, like join a gardening group, maybe go for a walk with a group. There's so many different things that can be done, and I love that this also respects the different demographics of folks, and it's not just one set for all groups, but like when you're talking about older generations, they're how they can get out and how they can socially be involved is much different than someone who's much younger. So I think it's an amazing program. Question for you is, you talk about its tracking. How do one track the positive outcome of this? How do we do that?
Well, that's one of the big challenges, and it's still a challenge all around the world in all the countries that are doing social prescribing. But the basic idea is to ask people how they're doing. So to really value self-reported health experiences and health outcomes as valid health data. So that's probably the easiest and most important one to do, to ask people how they're doing. But also you can measure things like their use of health services. So maybe they will be using healthcare services less because they're being more appropriately treated in other settings. But for some people, they might be seeing their healthcare provider more because they weren't controlling their disease well, and they're now finally getting the support they need to attend appointments. In one social prescribing program, they found that what the people really wanted was pet sitting, so that they could attend healthcare and other appointments and not worry about their pets being at home. So if you don't ask people what matters to them, what's important to them, you might never come to the realization that that's the thing they need most. And so tracking their use of healthcare services, tracking their self-reported outcomes, and then of course you can do more if you have the resources and capacity. So if you're focused on specific health measures, so if you're a person living with diabetes, maybe you're measuring your HbA1c levels to see how they change over time when you're getting more of this kind of support. So you can do some of those things as well, but usually there's not as much capacity to do that yet.
Right. When we talk about relating it to someone living with lupus, how do you feel that this can help someone that's living with this disease, or maybe even beyond the person living with the disease, but maybe a caregiver for someone with lupus?
I think the most important thing that it can do for someone living with lupus is provide a peer, a friend who gets what you're going through and can listen to you. Often we find the first meeting with a link worker or community connector is full of tears because no one's really ever asked them before how they're doing, like in a really more meaningful, deep way that is aligned with accompaniment and friendship. So sometimes it might take a couple of meetings before you get to making a plan. Or even articulating what all your strengths and needs are. So I think that's the most important thing. I think it can be pretty lonely living with lupus. And if you're living with lupus around lots of people who aren't, even if they love and care about you, they don't have that shared experience. And so it is really vital to connect with peers, people who get it. And that's true for caregivers too. So other caregivers or family members who are living with somebody with lupus, it can be hard. It's episodic. You never quite know what is going to be the issue of the week or the day or the month or the hour. And so that's hard for everybody. It's precarious. It's not stable. And so having some of these more stable components and relationships and people you can reach out to, I think that matters most. And then that link worker can help provide you with connections to other things that you can do that help you, that just help you feel better and promote your well-being overall.
We hear a lot from lupus patients that they want to be heard. They want to be listened to. And I think this is a big hurdle. And I think this type of program through social prescribing could really be of benefit to those living with this disease. What are some of the biggest hurdles when it comes to funding and keeping social prescribing programs running?
Well, I guess it's not an official part of our healthcare system right now, so it's not required. And often health organizations and healthcare providers are stuck prioritizing the things that they're accountable for. And so they got to meet their accountabilities, and they're struggling to do even that right now. People are feeling very stressed and very strained. Happily, social prescribing can really reduce that strain. So it can help move people on to more appropriate services, as I've mentioned, but it also feels really good for the healthcare provider. This helps healthcare providers to feel better about the work that they're doing, to reconnect with the reasons why they entered the healthcare profession, and to help them with the people who are really keeping them up at night, that they know they're not serving well. So people who are coming into the office frequently and just don't seem to be being helped by what they're able to do. And so there has been some good research demonstrating that it's also just good for the healthcare provider to know that they're helping people and taking action on the determinants of health that they know matter, but sometimes can't deal with in an easy way given the systems that they've got.
What advice would you give to healthcare professionals or community leaders who want to start or expand the social prescribing in their area? Like how can even someone who's listening to this say, well, how do I get involved? How do I participate in a program like this?
The thing that I have learned from watching social prescribing grow rapidly over the last few years here in Canada is that whatever you think your next step is, you're right, and go do that one. So if you're a patient or a caregiver or a participant, Ask your healthcare providers about social prescribing. See if there's something available. Reach out to Lupus Canada and see what they can help refer and connect you to. Those are some pretty good first steps. If you're a community organization worker or a healthcare worker, go to our website, which is socialprescribing.ca, and check out some of the resources we have gathered there that explain what social prescribing is in a little more detail and give you some clinical next steps and some pathways for getting started. Those are some of the things you can do right away. Often we tell community organizations, start out by doing an asset map of what's in your community. And that just means making a list of the kinds of supports and services that are out there for people that are already there, and make sure that you're able to connect the people who need them most to those services. So what are the food banks, or what are the gardening clubs, or what are the peer support groups that are out there? And then start with that map, because again, you want to start with what's strong, and then start connecting people there. And then you'll have a sense of what the next step after that needs to be once you get started on that journey. So the last thing I wanted to add was, if you're a person living with lupus or a caregiver or somebody impacted by lupus, don't underestimate the power of a coffee and a conversation, an engagement with art, a good book, a walk around the block. Some of these very small interventions, they might not seem like much, but they can really do wonders for your well-being, particularly if you do them with other people.
Thank you, Dr. Mulligan. Great advice. This is a fantastic program, and something, as you said right off the top, it's something that we all do, but we need to put this into something formal and better understand it. And I think for those living with lupus, it's going to be a critical program for them to live with lupus and live better, because it'll help their overall well-being. They'll feel like they're heard, and the loneliness, hopefully we can offset that loneliness so they can feel like they're part of a bigger community.